from Jadawn Wright. Jadawn is infectiously passionate and motivated by exceptional experiences working in HIV prevention and care, aligning herself with and amplifying the voices of people living with AIDS. And she works with she's the deputy director for the Pacific AIDS Education Training Center.
Thank you. So we are the Pacific AIDS. Oh. All right, can you guys hear me now? All right. So the Pacific AIDS Education Training Center is a HRSA-funded program. It's a national program, actually. There are 8 regional centers. And in the Pacific, we work in California, Hawaii, Arizona, and Nevada. And so because we have that regional approach, we have 8 local partners who we partner with at medical schools to be able to provide the training on the ground. They have the local expertise, they're looking at the needs of the community, and they're really a neutral convener that can help bring folks together, provide provider training, which I've heard a lot of the talk today is, you know, we want to provide a lot of new services. And one of the thoughts I had, and Ashe already brought this up, is who's going to do that work, and how are we going to ensure that the folks who are doing that work have access to training, have access to quality measures so that they can see themselves improving, and also so that we prevent burnout and we attract new folks to the field. So these are some of the issues that we are thinking about, we are working on at the local level, but also because we're a region, we're sharing resources across our region. So when we have, like last week, we brought 3 providers from Arizona to San Francisco to learn about transgender health in something we call a preceptorship, where they went into clinics, they got to meet with doctors who are doing transgender health and really learn what does it take to really help people who are living with HIV, also trans, what are the hormones, how do you provide the care, but what are your office staff need to know? Who else needs to be involved in that training? And I think traditionally the AATCs had been really focused on clinical training, which we still do. I don't want to make that we don't do that anymore, because we definitely do that. That's a cornerstone of what we do. But we realized that beyond providing pills, beyond providing medication, beyond providing medical interventions, there's the people skills, there's the engagement skills, there's the other folks on the team that do so much of the work that is really why people come or don't come into a clinical setting. So we're working with emergency departments, we're working with all kinds of FQHCs, especially in rural areas. I just had the opportunity to drive down here from the Bay Area because we needed to stop in Fresno to look at some clinical sites where we'll be just doing something called practice transformation, where we really take a clinic under our wing for about 5 years and really work with them from beginning, from we don't know anything about HIV. None of our providers do HIV care. We don't even know if there's people who have HIV in our community, to we're providing HIV care after that 5 years. And we did that in our last cycle, and we're continuing that with 8 clinics in our region who are gonna bring those 8 clinics along. So we're really excited about the various different types of options and the different types of ways that we can work with providers, with health departments, with community folks. We also facilitate conferences. We're a neutral convener. So when the health department says, hey, we want to bring people together, sometimes that can be loaded. You know, we've had experience in communities, but when the AATC says, hey, we want to bring people together, they're like, oh, you provide training and education? Oh, that can be a different take that some folks are more receptive to. So I think in closing, I want to just emphasize that we have all of these services, they're free of charge, but we also have constraints. Because they are free of charge, we are funded to do a particular work plan, and in order to support all of the innovative work that you guys are talking about, we're really looking for additional resources to support EHE projects, and also to look beyond ending the epidemic and how we're going to support those clinics afterwards. Once we've gotten prepped there, how do we continue to look at turnover? How do we continue to look at all of the support systems that are going to be needed to ensure that those people still are able to access quality care? So I have some few packets, so if you're available or you want to have really more information, come see me after. We also have a website, it's PAAETC.org. Our local partner in LA helped to coordinate this meeting, and I think those are the types of things that we're really known for and good at and that we can offer to y'all.